Welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we tackle the topic of the day fast and get you the take-home points you need so you understand the issue and are ready to either fix it or ask the right questions at your next dermatology appointment. Let's get started. Today, we are going to talk about Botox Basics. Botox is otherwise known as botulinum toxin A. It is a protein made by bacteria that is actually a white powder that is sold to doctors in little glass jars. We dilute it with salty water, otherwise known as normal saline, and then we inject it into muscles. We use it to weaken the muscles, usually for dermatology in the upper face, but it can be used elsewhere. It's been FDA approved for many years and it has lots of other uses. It's extremely safe. As of the recording of this episode, there are 4 brands on the market in the United States and a 5th that's been approved but not released. They are all very similar. They are versions of botulinum toxin A, so I'm going to talk about them at the moment together in one grouping underneath the category of Botox. The on-label areas that are approved for use for the brand name of Botox is the 11s, which is the glabellar area between the eyebrows, the forehead or the frontalis muscle, and the crow's feet or the sides of the eyes. We also use it in lots of off-label areas such as around the mouth, the neck, the chin, masseter muscles, and the cheeks. So there are lots of off-label areas and there's also the on-label. We do use it all over the face. There's many other uses for Botox, including FDA approvals for sweating, treating migraines. It has many FDA approvals and is used all over the body. It truly is a miracle drug. Now I want to go over what questions patients ask at the consultation. The most common question is, what are the side effects of a Botox injection? And that is very simple to answer because the side effects are very minimal. It is common to get a bruise or a black and blue mark that can last for a couple of days to a week or two. It is also somewhat common to get a headache the day or two after an injection, typically for headache-prone people. That goes away easily with medication or just time. The side effect that people worry about is the eyelid droop, which in the FDA-approved studies was up to 4% of people, but in the actual hands of good injectors, it is incredibly rare. I've been doing Botox injections for 22 years. I've only seen this side effect once, and I inject Botox every day at work. An eyelid droop is when the Botox actually moves into an eyelid muscle, and then it becomes hard to open the eye. The good news about this bad side effect is that number 1, it's incredibly rare. And number 2, it goes away. And number 3, it is treatable. There are eye drops that can be given over the counter or by prescription to minimize the side effect while the patient is waiting for it to go away. There are other common questions that I get asked. The next most common, I would say, is how long does it take to work? And the answer to that is a couple of days up to 2 weeks for full effect. Another common question is how often do I need to come for injections? And the answer to that is typically every 3 to 4 months. There are some patients who get longer out of it, but those are typically patients who've used it on an ongoing basis for many years. Another common question is, what age should I start? And that is very variable. There are people who start in their later teens, early 20s. There are a lot of people who start in their 30s, 40s, or even 50s. There are occasionally people who start in their 60s and 70s. It really can be helpful at many different ages. It is true that if you start it at a younger age, you can prevent wrinkles from appearing. So I do tend to like to start it earlier rather than later. But even if wrinkles are there, the Botox can really improve them significantly. So even at older ages, it is helpful to start it. A common issue that comes up at the consultation is that people are worried about looking weird. In fact, they are very worried about looking weird. They have seen people on TV, on social media, in their own personal lives looking odd from their Botox injections. Either they have weird eyebrows where they go up too high, or maybe their smile is off. Sometimes it's hard to tell, but they look different and funny. And I would explain that that is not the Botox itself, that is how it is being injected. That is the art of the Botox injections. So while Botox injections are incredibly safe, you need to make sure that you go to somebody who really understands it, who understands the art of it, and who does a really fantastic job and is an expert injector. A few good rules of thumb are to look for either a dermatologist, a plastic surgeon, a facial plastic surgeon, somebody who is board certified, check before and after photos, check their reputation, and also look at them. They often will be injecting themselves. They're often injecting their staff. How does their staff look? Do all those people look normal and natural and good? And that is a way to tell, is that somebody who you want to go to for your injections? So in review, the Botox Basics takeaway points are as follows. Botox is incredibly safe. It is FDA approved for reducing lines and wrinkles on the upper face, but it can be used off-label on the lower face and other areas. The main side effects are really bruising and occasionally a headache. Eyelid droop is incredibly rare and is treatable. It can be started at any age. Results should be natural if it's injected properly, and it should last around 3 months or so. I hope this episode answered your questions about Botox. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board certified dermatologist. I hope this episode was informative about the skin that you're in and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking to you again in the next episode.